Good afternoon and welcome to the second webinar in our Supporting Immigrants in Disaster series, Practical Matters, Tools for Supporting Immigrants in Disasters. Our co-hosts for this series are Houston Immigration Legal Services Collaborative and Grantmakers Concerned with Immigrants and Refugees. This is Regine Webster, Vice President at the Center for Disaster Philanthropy. A few reminders before we get started. First off, the webinar is being recorded. Secondly, you can submit questions at any time using the Q&A box at the bottom of the screen, and they'll be answered at the end of this panel presentation. Use that little Q&A box and not the chat box. And if you're on Twitter, please use hashtag CDP4Recovery to share the discussion. To provide us with some tools and ideas to use when addressing the needs of immigrants during disasters, we have these speakers joining us today. First, Kate Vickery is the Executive Director of the Houston Immigration Legal Services Collaborative, HILSC. It's a network of nonprofits, funders, law schools, and community stakeholders that provide legal and social services to immigrants in the greater Houston region. And then we also have Nirupa Netram, who is the Director of Foundation and Legal Operations at the Southwest Florida Community Foundation in Fort Myers, Florida. Nirupa launched the Foundation's immigration program and oversees related projects such as building broader communities across the Americas and On the Table, Southwest Florida. I'd love to welcome you both and thank you so much for taking time to speak with us today. What we're going to do is we're going to begin first with Nirupa, and she's going to share some information about the program she's launched with funding from GSER, which is the Grantmakers Concerned with Immigrants and Refugees, and the Florida State Bar Association to support immigrant populations following Hurricane Irma. Nirupa?
Thank you, Regine. I'm going to talk today about the tools that we use to support immigrants and refugees after Hurricane Irma here at the Southwest Florida Community Foundation. Next slide. At the Foundation, we have 10 cause areas, each with corresponding impact areas. They are philanthropy and community trust, community design, arts, community and culture, economy and jobs, education, animals, environment, equity and empowerment, climate change, health and safety. Immigration falls within the equity and empowerment cause. That cause is to ensure equity, inclusion, and access to opportunity for all residents of Southwest Florida. Next slide. We align all of our causes and impact areas with the United Nations Sustainable Development Goals. These 17 goals include reduced inequalities, sustainable cities and communities, peace, justice, and strong institutions, etc. Next slide, please. I wanted to share a little bit of the background information about immigrants in Florida and in our region. In 2017, Florida's immigrants paid $7.8 billion in state and local taxes. They held $91.9 billion in spending power. The picture below the $91.9 billion is what $91 billion looks like. Next slide. Our foundation serves 5 Southwest Florida counties. They are Charlotte County, Glades County, Collier County, Hendry County, and Lee County. We have a large foreign-born population and residents who are not U.S. citizens. According to the American Community Survey Profiles data from 2013 to 17, the foreign-born population is highest in Hendry County at 27.6%, and of those, 68.4% are not a U.S. citizen. The foreign-born population in Collier County is 24.3%, and of those, 57.6% are not a U.S. citizen. In Lee County, those numbers are 16.1%, and 53.8% of those are not a U.S. citizen. In Glades County, the foreign-born population is 11.4%, and of those, 70.7% are not a U.S. citizen. So Glades County has a very high population of non-U.S. citizens. The foreign-born population in Charlotte County is 10.2%, and of those, 38.9% are not a U.S. citizen. Next slide. I'll now talk about the grant-making tools that we use to distribute our immigration disaster relief funding. This screen outlines the general process that we used, which I'm going to discuss. As Regine mentioned earlier, we received funds for use in 2019 for our immigration program from the Florida Bar Foundation and Grantmakers Concerned with Immigrants and Refugees, or GSIR. We are very grateful for the one-year funding because raising funds has been the biggest challenge for our program. We do not yet have funding for 2020, and we disclose this in our grant guidelines. The Florida Bar Foundation's funds are specifically from disaster funding for Hurricane Irma. Irma was a Category 3 hurricane that severely impacted our 5 counties in the fall of 2017. Irma did the most damage in our low-income areas like Lehigh Acres, which is in Lee County, Moore Haven, which is in Glades County, and Immokalee, which is in Collier County. Florida has a really large number of mobile homes, and many of them were in Irma's path. Only about a third of those mobile homes were installed to current code, which means only a small number could withstand a storm like Irma. Undocumented immigrants rent many of these older, more vulnerable mobile homes and did not have the means to evacuate during the storm. As just one example, Immokalee has a high population of low-income farm workers. 1/4 of the housing is mobile homes. 44% of the population lives below the poverty line, and they had heavy flooding and substantial damage after Irma. Those immigrants and refugees in communities like Immokalee are still trying to deal with the loss of jobs, housing, and resources, and dealing with the fear and uncertainty of remaining in their communities. Before I wrote the guidelines, I actually researched good practices on disaster relief funding, which included a visit to Kate from the Houston Immigration Legal Services Collaborative. Kate was extremely helpful in her knowledge and expertise. So thank you, Kate. We launched a pre-grant survey to see which organizations were providing legal and related services in our region. We got responses from 14 organizations performing a range of services. After my trip to Houston, I then came back and wrote the grant guidelines. There is a link to the guidelines at the end of my presentation. In the guidelines, we listed eligibility, i.e. legal services, community outreach and education, advocacy and organizing, and capacity building. We also listed exclusions and general reporting information. We asked organizations how they would sustain their projects or programs beyond 1 year. We promoted our grant guidelines through our website and social media channels. We received 11 grant applications through our grants portal. We assigned reviewers, internal and external individuals who scored these applications directly through our grants portal. We then held discussions on which applicants would move to the next round, which is our Compassionate Shark Tank round. The Compassionate Shark Tank is like the TV show Shark Tank, but I always say our sharks have no teeth. I'll talk more about the Shark Tank in the next slide. Generally, during the Shark Tank, applicants have 3 minutes to pitch their ideas to a panelist of community stakeholders. We do compassionately cut off applicants at minute 3. Panelists have 7 minutes to ask applicants questions. The panelists also score the applicants. After the Compassionate Shark Tank, we reviewed the Shark Tank scores, questions, and comments, and then requested additional information if needed from applicants. We then made our funding decisions, sent letters of understanding, listing requirements and exclusions, and mailed the checks. We awarded funds through our grants portal, which also shows each grant funding source. We awarded funds to 6 grantees in 2019. Our grant period is January through December of 2019. Areas we funded are legal services, community outreach and education, capacity building, and advocacy and organizing. Combined, the grantees serve all Southwest Florida counties. We awarded a total of $615,000, which represents the largest amount in one cause area in the history of our foundation. Through our funding from Grantmakers Concerned with Immigrants and Refugees, we are the first and the only Delivering on the Dream collaborative in the entire state of Florida. Because of the great interest in our work in immigration, we formed an immigration learning community. We hold in-person meetings and networking quarterly, and these meetings are open to non-grantees. During the meetings, we have educational presentations and share good practices, challenges, opportunities, stories, collective impact, and resources. We have attendees from healthcare, human services, attorneys, consultants, our local law school, churches, and private citizens, including our donors. We have approximately 40 to 50 attendees at each of these meetings. We also have an immigration study group comprised of donors to our immigration efforts and other stakeholders. We meet monthly. We focus on strategies for fundraising and development. As part of our discussions, we discuss the need to fund organizations who serve undocumented populations. We talk about the compassionate side of immigration and the economic and impact and benefits that immigrants and refugees provide. The study group is an enthusiastic, dedicated, and passionate group. It's one of my most favorite meetings. The final step in our grant-making process is the reporting. We have midterm reports for the first 6 months and final reports for the entire 12 months. We use the reporting template from Grantmakers Concerned with Immigrants and Refugees, which captures deliverables and narratives, including storytelling and community impact. An example of the community impact that we've already seen from our program during its first 6 months is 5 of our grantees formed 16 new partnerships, which we think is really great community impact. We anticipate an increase in those numbers in the 1-year report. Next slide. I often get people's attention when I mention that one of our grant-making tools is we have a Compassionate Shark Tank. The Compassionate Shark Tank is a fun, informative, and learning process for applicants, panelists, and even for us. The benefits of the Shark Tank are it provides a distributed leadership process. It avoids unintended consequences. It reduces risk. It provides additional perspectives and considerations, and it allows for questions and input for our request for more information round. It provides opportunities for donors to fund projects and programs we may not be able to fund. Next slide. The Compassionate Shark Tank is an important consideration in our overall grant-making process. We provide trainings for applicants going to the Shark Tank, and we also provide training for the panelists sitting on the Shark Tank. We invite those panelists to be on the panel. Philanthropists may sit in the audience of the Shark Tank and score projects. We involve multiple team members in the Shark Tank, each performing a different function. For example, we have team members who check in applicants. We have a different set of team members who escort applicants to the prep room. We have a staff member present in the prep room. We have staff then present in the tank, of course. And we have staff who escort applicants out of the tank. We time the entire Shark Tank day, and we actually adhere to every minute of that schedule. Next slide. We learned some really important lessons in the inaugural year of our grant-making program. So on your slide right now are the key takeaways or lessons that we learned. Whatever grant-making process you use, it's important that the process, whether simple or complex, is unbiased. It's important to consider the sustainability of potential grant projects. Feel free to ask applicants, how do they plan to sustain their project beyond the grant cycle, especially if you only have funding for a year? Ensure you engage non-grantee organizations and donors so they stay connected to your program and its achievements. The way we do this is through the Immigration Learning Community and the Immigration Study Group. It's also important to promote your programs. Promote it during meetings, tours. You never know the connections or potential collaborations that can form. It's also important to find sustainable funding sources. Because fundraising can be a challenge and your funding may only be for a limited time, it's important to secure long-term funding and/or develop a plan B. It's also important to align all of your organization's projects and programs. As I mentioned, we align our causes and impact areas around the United Nations Sustainable Development Goals. Next slide. On this slide, you'll see the links to the immigration program guidelines that I discussed, our actual immigration website, and my email and phone number. Please feel free to reach out to me at any time. Thank you so much for your time today.
Thank you so much, Nirupa. Seriously, I'm just so grateful to hear about how you've been able to focus some funding on these vulnerable communities in Florida. Reminder to those of you who are listening in, we'll provide an opportunity for each of our speakers to answer questions at the end of all presentations. And just remember, you can ask questions by entering them in that little Q&A box at the bottom of your screen. So we'll turn away from Nirupa for just a few minutes and turn over to Kate Vickery with HILSC. Kate?
Thanks so much, Regine and Nirupa. It's like such an honor to get to do this presentation with you. We're going to move along the Gulf Coast now to talking a little bit about some of the things and the tools that we're using in Houston. And I want to ground us. I went through some of this on the last webinar. I know there are some people who are on our first webinar as well, so I'm not going to go over a lot of the demographics of what our immigrant population looks like in the greater Houston region, but we are 25% foreign born in our region. Fully 10% of our population is estimated to be undocumented. That's more than 500,000 people. About 44% of kids in our region live in families with at least one foreign born parent. So these are the mixed status families that I'll talk about a little bit in my presentation. And similar to what Nirupa was sharing about the economic contributions of immigrants to our region, about 26% of our GDP was contributed by foreign-born residents, and 32% of our workforce are immigrant. Half of the construction workers in our region are foreign-born. Next slide. So I'm going to talk a little bit about a plan that we have put together over the last year called the Humanitarian Action Plan. And we launched this about 9 months after Hurricane Harvey as a result of many conversations that we were having, we are a collaborative of service providers, immigration legal services providers, advocacy organizations, and social services providers. We are not disaster responders, but what came up for us after Harvey was that there was a real need for someone to take a leadership role in drawing some of the really in-depth conclusions and intersections between immigration and disaster relief. So I'm going to talk a little bit about how we developed a humanitarian action plan, and the baseline for our plan, and I'll show you where you can read more about this online as well, is that just as a baseline, immigrants are disproportionately impacted by disasters, and we have data locally that show that, that some of our local funders helped do as an in-depth survey. So the statistic that in and around the greater Houston region, immigrants are more likely to report income or job loss due to Harvey. 64% of foreign-born versus 39% of U.S.-born reported that. That comes from a study that was done by Kaiser and the Episcopal Health Foundation. And there's a lot of other data that has informed us as well. We know that many of the day laborers and workers in our region did not and continue to this day don't feel safe asking for help from the government, even for families that were eligible for FEMA or for other relief. A lot of people self-selected out of a lot of those relief programs, and there's data to back that up. We also know that, people living in poverty, and for us, green card, about 24% of our green card holders live below the poverty level. About 28% of our undocumented population live below the poverty level. And folks who live in poverty suffer social, economic, and cultural losses at disproportionate rates. And what we've also learned is that obviously the more privilege you have, the better your ability is to recover more quickly. And there's research also showing that the more FEMA aid that areas receive, the more wealth inequality grows. And so for a place like us, where FEMA aid is not available to a huge percentage of families who are impacted by Harvey, that wealth inequality grows even more in our region. Next slide. So our humanitarian action plan process started, and we have a wonderful consultant who has a public health background who is really leading this work for us. She started this process by, the plan has, she started this process by doing interviews with most of our member organizations, right? We're an existing collaborative. We've been around for 5 years. We have a lot of organizations that work directly with low-income immigrants and that already have the trust of that population. So she did interviews with about 40 organizations, focus groups with undocumented immigrant clients directly, systems level agencies, groups like the Red Cross, the City of Houston Health Department, our city and county OEMs, FEMA, our large community foundations, and our United Way. So we were trying to get at 3 different levels of information to help us inform what would eventually become a plan with 34 recommendations in it, 10 of which are commitments that we as an organization are making to continue to operate in this space, and all of which are a stretch and beyond what HILSC initially considered itself to have a role in playing in our region. So on the next slide, we will see that based on all of that information gathering in those interviews, we have kind of 3 big buckets of themes that all of the things that everybody talked to us about, they really fell into 3 big buckets. So the first one was around the need for all disaster recovery, response, and preparation. Communications really needed to be inclusive, and not just around language access, but accessible access, accurate and timely information available to immigrant communities. So that inclusive communication theme came through in all of those interviews at all levels. The second big theme was around the need for there really need to be accessible resources. So this is on all 3 levels of preparedness, response, and recovery assistance. Resources really need to be accessible and understandable, and particularly this need for private philanthropy to prioritize accessibility for populations that don't have access to some of the publicly funded disaster recovery work really came through in this sort of accessible resource theme. And then the third big bucket of the theme in our research was around the need for culturally competent approaches. So everybody who plays a role in emergency management really needs to understand and address the core needs of immigrants and to strategically design processes, services, and materials to meet those needs. And in that, there's a cultural competency piece on there. We have recommendations around what it means to be trauma-informed in disaster response, and all of that really kind of falls into that third theme. So those are the three big themes that we heard. On the next slide, I'll show you, so if you go to hap.houstonimmigration.org, you can see the full humanitarian action plan. It has each of those sections on the top there, the summary, the immigrant profile, political context, background, methodology, and recommendations. Those are each different sections and you can navigate through. You can also download the full plan in English and Spanish, as well as the executive summary, both in English and Spanish. And while this is definitely rooted in our Houston experience, a lot of the data and the research about barriers for immigrants is applicable anywhere in the country that's grappling with these issues. The plan itself is, when you navigate through the recommendation section of the plan, sorry, next slide. When you navigate through the recommendation section, you'll kind of see, we've set it up so that you can actually filter the recommendations that we've made by a few different sets of criteria. So you can look at just the preparedness recommendations, just recovery, just response by filtering by disaster phase. You can filter by the level of the implementers that we're recommending, either federal and state, city and county, or nonprofit. There are three choices for implementation approach: policy, program, and operations, and funding. And I'm going to share 4 of the funding related recommendations in just a minute. And then you can also filter by those 3 themes that I just talked about inclusive communication, accessible resource, and cultural competencies. So you can kind of see where things fall. And obviously some of the recommendations fall into multiple of those categories, but our intention was to make it really easy for people to really interact with this plan and learn from it. Next slide. So if there's 3 big things that we want everybody to understand as being sort of the prerequisite for immigrant resilience when we're thinking about preparedness, recovery, and response. And the 3 big things are: 1, we know it's really important that the data that's informing policy and funding decisions includes immigrants. It largely does not, because a lot of the data that is used is coming from FEMA data, which, as we know, and I talked about on the last webinar, there are many reasons why that data excludes many immigrant families and definitely undercounts the actual need. So we're recommending research institutions who can help regions actually understand their immigrant population and get at some estimates of where the mismatch in the data might be. Migration Policy Institute is in DC and the Center for Migration Studies is in New York. Both of them have methodologies for estimating the undocumented population in region. We've commissioned reports from the Migration Policy Institute, and they've really helped us understand what our region looks like. So having that data is really important as a baseline. Second is really the need to inform policy and funding decisions with immigrants' lived experiences. We see this all the time, of course, and especially in the disaster space. We've seen over and over that disaster recovery spaces are largely don't talk at all about immigrant-specific issues. Immigrant rights spaces don't talk at all about disaster issues. And then for particularly vulnerable populations like immigrants with disabilities, for example, they're left out of the conversation entirely. And so planning and funding decisions really need to bring directly impacted folks from diverse populations to the table to help those decisions get made in the best way to actually meet the needs of some of these populations. And similarly to that is to actually go for funders and institutions to consult with immigrant serving organizations and constituents in emergency planning. So long before we're actually in this moment of, oh shoot, is our money getting to the right populations? The planning process really needs to be more inclusive and include a lot of these populations as well and these organizations. Next slide. So I'm going to talk about 4 specific recommendations. I mentioned there are 34 recommendations in this plan. I'm going to touch on 4 of them. The first one, and these are all in, I hope that these come through as being exceptionally accessible and practical and useful for other funders and other places to take away. So the first one I want to talk about is actually recommendation 21. It's called the Immigrant Accessibility Index. And what we're recommending is that funders and institutions employ a tool that we've developed called the Immigrant Accessibility Index, which is a self-assessment tool to help identify opportunities within an organization's policies and practices to reduce barriers and increase immigrant access to services. So you'll see here on this slide, this is the way we do these presentations here locally. And so you'll see who the proposed implementers are and who our target is for this recommendation. And then you can all Hi, all. Can someone confirm that you can hear me? I'm so sorry, I just got kicked off.
I can hear you. This is Regine.
Okay, great. So sorry.
It happens. I'm glad you're back so quickly.
Yay, okay, good. Okay, great. So I just kind of give the overview of what the Immigrant Accessibility Index are. And if you'd advance to the next slide, Regine, I'll explain a little bit more about what the purpose of this is. So the purpose of this tool is to help social services organizations, as well as funders and
agencies, assess the extent to which their services are accessible to all immigrants regardless of legal status. And when we say accessibility, we've defined it in this way, and because accessibility obviously is a big bucket. So we are defining organizational and systemic accessibility as including both policies and practices, and that those policies and practices be trauma-informed, culturally welcoming, physically and linguistically accessible, and focused on building equity within an organization systemically. The other framework for this tool is, I've borrowed this, if any of you have done trainings with the Management Center, they use something called the PTR framework. PTR stands for preferences, traditions, or requirements. And I think this is a really helpful framework for when we're thinking about breaking down barriers to immigrants in service delivery. So preferences are tied to our personal values and ethos. Traditions are tied to an organization's set of values and ethos. Requirements, on the other hand, are legally binding requirements by funders, are things that really are immovable. But preferences and traditions are movable. And what we're kind of saying globally is that if there's a policy or practice in your organization or in your ability to give out funding that is actually just a preference or a tradition and it's a barrier for immigrants, change it. What's stopping you? And so part of this tool is really helping people give themselves some options and to help highlight some of those areas that are in fact barriers. So let me give you a couple of examples. So on the next slide, and again, I'm not going to go through this whole thing. It's a 25-question questionnaire, and we don't have the link live on our website, but I will email it out to everyone and make it available. You can contact me directly. We can get it out to everybody who's a participant here. So the first question here is just asking for your agency or organization, or for funders in particular, if you're trying to evaluate the extent to which an organization that you're considering giving money to for disaster recovery, for example, and that organization is saying, oh yes, we're going to prioritize immigrant communities, you would want to know up front whether or not that organization is already deeply rooted in providing services to that population. So the first question, just very basically, is who are your clients, right, in terms of immigrant population? And we get a lot of questions here about how do I assess that without creating an unnecessary barrier by having one of my questions be, what is your legal status? We're definitely not recommending that you ask up front what legal status every client has, but there are two good proxies that you can use. So whether asking for a country of birth and the preferred language spoken at home. So those are two good proxies for knowing whether or not an organization's client base is largely immigrant. And so for funders, if an organization is saying, we want to do this work in immigrant communities, and their numbers on these answers are extraordinarily low, or they don't even track them, I would recommend that you would conduct further analysis about the organization's track record for serving this population and think about going to some different organizations. And it's often not the big organizations that have these deep relationships. It's small grassroots organizations. We talked about that on the last webinar. On the next slide, I'll show you another example of a question
This is really in the weeds, and this is, I think there are ways for funders to implement, to ask questions like this when you're evaluating an organization, especially in site visit processes. So one of the big barriers here is in the types of IDs that organizations require for somebody seeking services from their agency. So right off the bat, we know a lot of organizations require a social security number. If there's not a legal reason to be requiring a social security number, you shouldn't be asking for a social security number. That is a barrier unto itself. And you will absolutely not serve immigrant populations, and many of whom don't have social security numbers if that's your first question. So we're asking organizations to think about what type of ID do you require? And the encouragement, the recommendation here is that US issued government ID, non-government ID, foreign issued government ID, visas, non-photo documents, and alternative evidence such as an ICE detention ID, an Office of Refugee Resettlement ID, a letter from an agency, an affidavit from someone. It is something that isn't government issued and even doesn't have a photo on it, either a current one or an expired one, being as inclusive as possible in terms of how we identify somebody's, how we confirm somebody's identification is going to be the most equitable practice that we can. So if there's ID that an organization requires, but it's not a requirement that they do that, it's a preference or a tradition, that would be a great opportunity to break down some barriers. Because if you're requiring a US government issued ID, or even another photo ID, especially for people who are coming directly out of immigration detention, for example, let's break down that barrier. On the next slide, I'll give you 4 examples of sort of some policy questions that are part of this tool. So we're asking if organizations have trained their staff on public charge, and if they understand how to advise clients who have questions about how receiving services could impact their immigration case. We as an organization offer that training, and there are lots of trainings that organizations can access in order to inform their staff on that. We're asking questions about whether or not an organization has procedures in case ICE were to come to their agency to either arrest an individual or to request access to agency's client data. The recommendation is that every organization have a policy for that. We're also recommending that an organization have a visible non-discrimination policy, which explicitly names citizenship and immigration status as one of the non-discrimination policies. And then finally, the last example that I'll give here is whether or not an organization has a client confidentiality waiver that ensures that client data won't be shared with outside entities, including government agencies. Again, that's a huge barrier and a huge red flag for people seeking services. On the next slide, I'm going to quickly go through the last 3 recommendations that we have here. So the second recommendation that I want to touch on is our recommendation that funders invest in increasing the capacity of both civil and immigration legal services and provide support to the coordination of those services with disaster case managers to ensure that immigrants in particular are getting their holistic legal needs met. And the way that we've implemented this here in Houston, and this was in partnership with the Center for Disaster Philanthropy, who's provided the funding for this on the next slide, we're funding via the Center for Disaster Philanthropy and our collaborative. We have funded 4 immigration fellows as part of a disaster recovery legal corps, which has 21 civil legal aid attorneys in the Texas region. We're funding 4 immigration attorneys. Disaster recovery legal corps have never before, to my knowledge, included immigration attorneys who can help with any type of immigration legal need. And the idea here is that we can help people become less vulnerable in the next disaster if they are not completely without legal status. So in the first year of this program, 305 individuals have received legal assistance. 100 cases have closed so far, and 24% of those folks are legal permanent residents. 66% were undocumented when they started, and 12% have some other status. So this is a really direct way to make an impact on immigrant families at any point. This is a preparation strategy and a recovery strategy, is to help people along a pathway towards some sort of status. On the next slide, this was one of the first things that came out in the recommendations, and this is that the helper organizations, and especially those that target and serve an immigrant population, have to be prepared and have the ability to maintain their own services in a disaster. So if the grassroots organization that is the most trusted source of information for the immigrant community in Southwest Houston gets flooded and can't work, then they can't serve their population that they have relationships with. So we're recommending that every immigrant serving organization and every organization have a continuation of operations plan. On the next slide, you'll see, we worked with the Harris County Office of Emergency Management, who actually provided us with a consultant to train immigrant serving organizations on how to create a COOP plan. Most organizations don't have them. And this chart here kind of shows some of the areas of a COOP that has to be developed. They're hard and complex, and they take time, and people and the organizations need time to be able to create them. But we've been providing one-on-one technical assistance by this trainer, and we're going to be using a COOP as a criteria for future HILSC funding as a way to incentivize organizations to do these. What we've learned is that these are really critical. Organizations need help in order to do them. It's complex and time-consuming, and they need funding in order to support this planning, but it's really important. And the organizations who don't have these are the ones that most need them. And finally, the last recommendation that I want to touch on is on the recommendation for cash assistance. So I mentioned this in the opening. We're recommending, and this came up over and over again, that funds raised for financial assistance, there need to be specific funds raised for financial assistance to immigrants whose needs were created or worsened by a disaster, and to make sure that those funds are distributed to vetted organizations that serve immigrants regardless of status. And this funding needs to be private funding because there should be no strings attached to private funding based on immigration status. On the next slide, I'll just share really quickly the impact of the way that we have implemented this recommendation. So we used a portion of our HAPI Assistance for Immigrants Fund, $200,000. We also use a participatory grant making process similar to what Nirupa described, though we don't use a Shark Tank. We maybe should. We gave 7 grants to organizations that already had wait lists of immigrant clients in need of direct assistance. That was the most important criteria. But ensure that the support would be distributed to clients who didn't have access to government funding or who chose not to out of a pragmatic assessment about the risk they were putting their family under, and that to organizations that are deeply rooted in the immigrant communities. 325 people were assisted with basic expenses through this cash assistance program. 10% of that funding was available to administrative costs for the organizations. And the link down there is for the full report of the impact of that funding. Finally, I just want to say, on the next slide, I do just want to hit one final kind of thing about what we learned from these grants. So there's overlapping complexity for these families, and having mixed immigration status or no immigration status is sort of the baseline vulnerability that makes it really difficult and important to get private dollars into those families' hands. But the things that overlap on top of that are families that have domestic violence situations happening in them, because individuals often get held hostage in domestic violence situations based on their immigration status. So that's a huge barrier and vulnerability. Immigrants with disabilities face disproportionate risks, and I can't say enough about how badly our region does in terms of serving immigrants with disabilities. But for families with disabilities, that's definitely an overlapping barrier. Families with insecure housing, and the fact that many undocumented families, and Nirupa touched on this, don't have clear title to their housing. So when clear title is a requirement for assistance funding, a lot of mixed status families don't have that, and the need for legal aid to help those families clear title for their property is huge. And that was one of the big things that we've taken away. And then finally, for low-wage workers, there's obviously a huge overlap here. Low-wage workers post-Harvey have suffered from a lot of wage theft. 25% of the wage theft cases brought to our local worker center have been Harvey-related in the past 2 years. And in general, there's also a huge gender imbalance here. Women are making far less than their male counterparts, and we really need to see an expansion of the infrastructure of legal resources for workers who are the second wave of responders post-disaster. So I've gone over my time, and on my last slide, I'll just repeat back kind of my 4 big takeaways about what I hope we all take away from the tools that I'm offering here is to really get educated about the barriers to immigrant recovery and to do everything we can to break down those barriers. So that's that immigrant accessibility tool that I'm offering. Second is to fund civil and immigration legal services as part of recovery preparation and response. And you can do that through a fellowship program like we've done, or through direct funding to legal services organizations. 3 is to provide capacity building to immigrant serving organizations so they're prepared for a disaster. That's that continuation of operations planning that we've been doing. And then 4 is to really focus and prioritize private funding to organizations that are rooted in immigrant communities and that have a track record of serving immigrants. And our example of the Harvey Assistance for Immigrants Fund is an example that you can look at. So I'm very happy to take questions on any of those 4 strategies that I'm offering today, and I hope that they are practical and useful.
Awesome. Thank you so much, Kate. You've given us a ton to think about and consider as the funders and other organizations on the line focus their support on helping immigrant communities. I've got a couple questions teed up here, and we're going to zip through. So Kate and Nirupa, if you can keep your answers tight, then we can get a couple more questions in. First question is from Carlos, and I'm not going to say your last name, although it's beautiful, but I don't want to say it wrong. You mentioned that nearly 64% of undocumented laborers do not feel safe asking for help. It's my understanding that there's no help for undocumented laborers. If I'm wrong, what help is available? I've been asked this question in the field while at a disaster and have not been able to give them a direct answer.
Yeah, that's a great question. So if you're an undocumented day laborer, but you have a US citizen child in your house, you are in fact eligible to apply for FEMA, but many of those mixed status families do not apply out of a practical assessment about the risk that they might be exposing their family to. And the other help that's available is through private agencies. And in Houston, it's a lot of our members who do direct cash assistance to individuals regardless of immigration status.
Super helpful. Nirupa, question for you. You mentioned projects that you were not able to fund. Could you describe one of those projects and what the restrictions were?
You'll see on the link the grant guidelines. The projects we weren't able to fund are those that didn't meet the requirements of our grant guidelines. They either fell under an exclusion or, were ineligible otherwise, didn't meet those requirements. And we only had a certain amount of funding. So we scored our top scores, based on the Shark Tank, based on the other scores. And so some projects were not able to be funded.
Above the, to bring in another show, above the line, or above the yellow line and below the yellow line?
Yes.
Okay, so second question for you. Kate spoke, for you, Nirupa, but referencing something that Kate talked about was about making their work, really culturally competent. Can you talk about how that comes into play over in your work?
We try to include cultural competence in all of our projects. Some of the things that Kate is doing is really amazing and progressive, and we are still falling within some of the restrictions of operating as a foundation. We are not our own 501c3. So I would say just in general, we include cultural competency as part of every project that we do.
Great.
Just maybe need more specifics on that question.
Just was wondering how cultural competency comes into play and how you orient your work there, but that was a super helpful answer. Let me ask one last question over to Kate. You know, in thinking about the implementation of your work, is it being welcomed? Is it being used? What's the uptake?
Yeah, oh, I appreciate that question. So the Humanitarian Action Plan, you know, we wrote it, we launched it in March, and now we're in implementation phase, and which is more like advocacy phase, right? So all of the agencies that, you know, that helped inform, we are now in this moment. So we are presenting this information and this plan and these recommendations to everyone and anyone who will listen to us in the region. And we've had an extraordinarily positive response. And a lot of agencies are asking for that immigrant accessibility index and starting to implement that internally. I'll be honest, we don't have the capacity to kind of walk every organization through that assessment. And so we've tried to build it in to be as self-directed as possible, right? And the big thing that we're advocating for right now is to get a lot of the recommendations. There are about 12 of the recommendations that are specifically targeted for strategic plans of government agencies. So we've got some recommendations I didn't talk about today around language accessibility, for example, and accessibility for people with disabilities. Those are priorities and values that can be built into the strategic plans of public agencies. And I feel like we're close to that, and we're working really closely with our county government officials, both on the agency side and on the elected official side, because it's the elected officials actually who really love this, and they are helping us push the agencies into some of these more uncomfortable spaces that they frankly don't have a ton of expertise in, but are interested in doing more. So we're definitely very much in the midst of implementation and advocacy phase of this plan.
Excellent. Okay, a couple more questions have come in. One, local long-term recovery groups can make decisions to assist immigrants regardless of legal immigration status. Would there be monies available for these groups?
I feel like that's a question for the Center for Disaster Philanthropy.
Okay, thank you, Kate. That's kind of you. I would say yes, certainly. You know, there are certain funders out there, and sometimes the Center for Disaster Philanthropy is one of those funders to long-term recovery groups. So yes, and it's disaster dependent. I wish there were that funders abounded who had the ability to support long-term recovery committees in advance of or well past the date of a particular event. So certainly whoever asked that question is more than welcome to email me at regine.webster@disasterphilanthropy.org, and we can talk offline about that if you'd like to. This question, Kate, I think is for you. Would it be possible to look at a continuity plan of any of the, or maybe it's for Nirupa too, excuse me. Would it be possible to look at a continuity plan of any of the nonprofit organizations that were provided this support?
Yes, I know everybody is still working on theirs, so I don't have a final one to offer you. We're doing ours as well right now. I do have a sample that I can provide. I don't have a complete one to offer right now because people just wrapped up their one-on-one meetings with the consultant last week.
Okie doke. Mm-hmm. That I think would be great. Well, I think I'm going to go ahead. And sorry, gang, I'm looking at my notes to see if there's other questions. No other questions on my end. So I'll go ahead and start to bring us to a close. So to those of you who may be planning disaster response funding, CDP has many additional resources and information in our disaster playbook. You can find it at disasterplaybook.org. We've also created a list of suggestions for foundations to consider related to disaster giving that we want to share with you as takeaways today. First, we really suggest that you take the long view. Recovery from any disaster will take a long time and funding will be needed throughout. You can even hear the disasters that we're talking about here. Irma, you know, the work that relates to these disasters is coming from Harvey, Irma, Maria, and both Kate and Nirupa are still very much working on this. We hope that you all will have an unbiased grant-making process, one that really supports and brings in the needs of immigrants in any particular community. engage non-grantee organizations and donors, get educated about what the barriers are to immigrant recovery in your region and work to break them down, provide capacity building to immigrant serving organizations so they're fully prepared for disaster, and then lastly, recognize that there are places private philanthropy can help that government agencies may not be able to. I want to thank you all for attending, and I want to give special thanks to Kate and Nirupa for taking the time to share their insights with us. Special thanks again to our co-hosts, Grantmakers Concerned with Immigrants and Refugees, and the Houston Immigration Legal Services Collaborative. If you have any questions or thoughts that were not addressed during today's webinar, you're more than welcome to email me at regine.webster@disasterphilanthropy.org. Thank you all so much for joining us today and your interest in this important topic.